in 3 minutes, we're going to learn a little bit about what's really a hot topic right now. It's insulin resistance, right? 3 main causes of diseases. One is hyperinsulinemia, high insulin. Insulin resistance is the root cause of most disease processes, and chronic inflammation. 3 things, right? Chronic high insulin is the reason for many diseases, type 2 diabetes being one. Starts with the food we eat, right? I mean, it literally, that's why I always film in the kitchen, because it literally starts with the food that you put in your body. Chronic insulin high equals insulin resistance due to sugar and carbs, okay? And I talked about that with some of the popular this. If you're having insulin issues and it keeps rising, your blood sugar keeps rising, it's the insulin, it's the sugar you can put in your mouth. Type 2 diabetes, obesity, hypertension, liver diseases, that's all what's coming from this, right? So what you put in your mouth matters. If you're tired of having high blood glucose, stop the carbs and the sugar. Stop the processed food. So both insulin resistance and autoimmune diseases cause inflammation, right? So that's why the number one cause of death in diabetes type 2 is heart disease, inflammation. Remove processed foods, reverse insulin resistance will allow your gut to heal, and that chronic inflammation will go down. Because as Ben Bikman says, with no excess insulin, no fat is present. How do you know that? Let's give a quick example. Diabulimia. Type 1 diabetics when they want to get thin. I had 2 patients of mine, they were 18 years old and they were wasting. They were so thin. Their blood glucose, they were swimming in blood glucose. I think it was like 500, one lady. So if you want to heal, stop increasing your sugar in your body, which causes to increases in insulin. Okay? Because if you're insulin resistant, you're just going to be swimming in goo. Food is the real medicine if you want to fix your diet. Food is the real medicine if you want to fix your diet. Okay? Why do I hold notes? Because dang, I can't seem to get through if I don't look like I'm teaching, which this is what I do. I'm an educator. So as an insulin resistant person, your risk for type 2 is very high. They're one and the same. How do you know if you're insulin resistant? Skin tags, belly fat, high blood pressure, exhausted, brain fog, skin tags, the acanthus nigricans that goes around your neck, it's black. You kind of know that you're insulin resistant. Know your fasting insulin levels before you know anything else and see what it is. Know your triglycerides and know your HDL. Those are 3 things if you take from today. Reversing insulin resistance, exercise, weight training, you can do it.